America is leading the world, not in innovation, not in healthcare advancements, but in chronic disease, neurological disorders, and metabolic dysfunction. The root cause? Unconstitutional laws, ignored mandates, and Congress's direct role in protecting corporate profits over public health. While people argue about vaccines, food additives, and environmental toxins, the one factor that aligns perfectly with the rise of autism, ADHD, cancer, and metabolic disease is the unchecked expansion of wireless radiation. Unlike vaccines, which some claim cause health issues but don't explain the full scope of chronic illness, wireless exposure correlates precisely with every major health crisis of the last 30 years. The timing, the expansion, the exposure, it all lines up. This is not a coincidence. This is a U.S. government-mandated health crisis. Congress mandated chronic illness, the unconstitutional foundation of a public health nightmare. Section 704 of the 1996 Telecommunications Act prohibits local governments from blocking wireless infrastructure based on health concerns. This law effectively silences the public, stripping them of their right to challenge dangerous infrastructure near homes and schools. The government didn't just allow wireless expansion, it forced it, with no health-based checks or balances. The FCC, an agency with no medical expertise, was put in charge of setting safety standards that have remained unchanged since the 1980s. Wireless radiation exposure is not a side effect of modern life. It is a federally protected hazard, placed above public safety. The perfect timeline: wireless expansion and the rise of chronic disease. 1996. Telecommunications Act is passed, shielding wireless infrastructure from health-based objections. 1999 to 2005. Massive expansion of cell towers, Wi-Fi, and early 3G networks. 2000s to present. Explosive growth of smart devices, Wi-Fi in schools, and 4G/5G. 2000s to present. Autism, ADHD, metabolic diseases, neurological disorders, and brain cancers skyrocket. This correlation is too strong to ignore. Unlike vaccines, which don't apply to the entire population, wireless radiation exposure affects everyone, everywhere, 24/7. The suppression of science. When the government ignores its own research. The National Toxicology Program's NTP groundbreaking study. The NTP's $30 million study found clear evidence of cancer from cell phone radiation. The response? Instead of expanding research, funding was cut. This is a direct violation of Public Law 90/602, which mandates continuous radiation safety evaluation. The FCC's 2021 courtroom defeat. A federal court ruled that the FCC's safety guidelines were outdated and failed to consider modern research. Despite this ruling, Congress has done nothing to enforce updated regulations. Congressional inaction is not just negligence, it is willful complicity in the largest public health crisis of our time. Wireless radiation and health: what the science really says. Neurological disorders, ADHD, and autism. Studies show that RF exposure disrupts calcium ion channels, which are crucial for brain function. Cognitive decline includes long-term wireless exposure being linked to memory loss, brain fog, and neurodegeneration, cancer, and cellular damage. The NTP study confirmed DNA damage and increased tumor risk. Oxidative stress from RF exposure accelerates aging and disease, metabolic and reproductive disorders, diabetes and obesity. RF radiation interferes with insulin signaling and metabolic function. Infertility. Multiple studies show that RF exposure reduces sperm quality and egg viability. The fact that these studies exist, yet Congress refuses to act, proves that this crisis is not accidental. It is engineered. A corporate-government alliance, the wireless industry's regulatory capture. Congress didn't just pass bad laws, they created a system that protects telecom profits at all costs. The FCC is run by former telecom executives. The FDA refuses to enforce Public Law 9602. The WHO still classifies RF radiation as possibly carcinogenic, yet takes no action. Local governments are legally silenced from acting to protect their communities. This isn't a public health system. It's a public relations strategy for corporate interests. Solutions: how we reverse this mandated health crisis. Step 1. Repeal Section 704. Restore the right of communities to challenge cell tower placements. Demand local and state control over wireless expansion. Step 2. Enforce Public Law 9602. Restart the NTP's research. Force the FDA and FCC to update RF safety standards based on modern science. Step 3. Demand safe technology. Invest in Li-Fi, light-based communication to eliminate microwave radiation risks. Push for space-based telecom networks to reduce ground-level RF exposure. Advocate for interferometric antennas that minimize user exposure. Final thoughts: holding Congress accountable. Wireless radiation is not a technological inevitability, it is a legally enforced hazard. Congress didn't just allow this to happen, they mandated it. If you are sick, if your children struggle with neurological disorders, if chronic illness is consuming your life, you need to know the truth. This is not genetics. This is not bad luck. This is policy. Congress enabled the FCC to dictate health policy despite having no medical expertise. Congress ensured that local governments could not protect their citizens. Congress ignored federal law and suppressed the research proving harm. Congress allowed the telecom industry to grow unchecked, knowing full well the health consequences. What comes next? The American people must demand change, not just awareness, but action. Repeal Section 704. Enforce Public Law 9602. Expose the regulatory corruption at the heart of this crisis. This is not just a failure of oversight. This is a government-mandated epidemic, and it's time we fought back. Visit RF Safe to learn more.